Hi guys, good afternoon, good morning, good day wherever you're watching me from. It's your girl again, Fumi's Page. Hi, welcome back to my channel. Um, Thank you for stopping by to watch this video. If you're a returning subscriber, give a thumbs up. Thank you for stopping by and clicking the video to watch. And if you just stumbled on this video, you just scrolling down your phone and you saw this video and you decided to click to watch, thank you so much for clicking. My name is Fumi Speech. I'm a special education needs therapist working with special needs children, and I've created this channel to enlighten people more about special needs children and how you can be able to manage them if you have one or you're currently working with special needs children. So this will be a channel that you want to learn more things about taking care of special needs children. So you're warmly welcome to the channel, and please do consider to subscribe to my channel in order to make my channel grow. And I thank you in appreciation and thank you in advance. Okay guys, today I'm going to be talking about some possible behaviors that special needs children display, or what are the possible behaviors that can be seen in a special needs child. But before I go into that in details, I quickly want to explain who special needs children are. So special needs children are the children that, or they are kind of kids that find it difficult to learn or sustain their learning when compared to their age group or age mates. So if a child is having difficulty or is having to retain information for a period of, let's say, for a longer period of time, and the child is not able to sustain the skills, or the child is not able to learn as the age group or his or her age group, then with the assessment and all that, they can be categorized as special needs children because they need special attention to be able to learn as their age mates or age group do learn. So in the sense that you have to identify their strength first, you need to understand which of the special needs category can they be categorized into. So in the sense that we have different special needs, or different names that we do call them. We don't tag them as children of disability or something, no. We only categorize them as special needs children because they learn in a very special way. So one of the specialties is what I'm going to be talking about today. Although we have so many symptoms or so many categories that you can categorize these children to be able to know that yes, they are in need of special attention. So we have the autism, we have the ADHD, we have the apraxia, we have the dyslexia, we have the LD, which is learning disability. We have a lot of them, but my own focus will be from the autism and ADHD aspect and learning difficulty. So what are the possible behaviors that these children possess? So one of them is what I'm going to be discussing today. So the focus for today will be number one, attention deficits, just in the explanation I made earlier on. So there are some children that find it difficult to pay attention, both in the classroom or anywhere in the play, within the play area or the playground or anywhere they find themselves. So they lack this attention. So for instance, attention deficit is when, in a layman's language, the child is unable to attend to activity. It's always fleeting. Their attentions are always fleeting. 1 second they're focusing, and the other seconds their mind is out. Their mind is no more where they are learning. So they require special needs in that particular area. So inability to sustain attention, or inability to do a task for a specific period of time. So attention deficit is number one, and they cannot sustain attention on tasks for a longer period of time. So for instance, a typical child, when you give the typical child an instruction to be carried out in the classroom, and then they are supposed to do an activity, a special needs child that has been categorized as to be attention, that has attention deficit, the child will require special attention in order to follow through and to work in the pace with other kids. So you cannot give, let's say the child is having a mathematics sum to do, and they are unable to do it on their own. So they require special needs therapist, or special needs individual, or a kind of person like me to be able to instruct them and make them do the work at the pace to which other children are doing it. So when you talk about attention deficit, they are unable to sustain attention on a particular task. So they do, like, they engage in a task, and then within 1 minute they are off doing something else. So let's say, for instance, I give them this maybe to just play with, or maybe to form numbers with it. So this is just like a slime, and then the child is not able to complete or to continue the activity. The child disengages himself from doing the activity, or from continuing the activity. So in order for this not to happen, there is a specialist, which is me, that comes in and makes sure that the child is on task. So for instance, if the child is in front of the classroom teaching, and the child is in the midst of other typical child learning, so a typical child would not, the teacher would not give the instruction twice. The typical child already knows what he or she is supposed to do, but the special needs child requires that so much attention from the specialist to be able to pass the information in a very simple manner, or simple way, to that particular special needs child, because he or she lacks attention on the task. So the minutes, also attention deficit could also mean when the time it takes for a child to solve a mathematics question or a sum, maybe 1 minute, it will take like 10 minutes or 15 minutes for a regular child to be able to assimilate that same sum, or to be able to complete that same sum. So these are where special needs instructors come in to assist. And also, in another form of attention deficit could be not listening to spoken words. So for instance, if you give a typical child an instruction you give a typical child instruction, the child already knows what you're talking about, and then he or she carries out the instruction without any interruption. But it's not like that with special needs children. You have to repeat, and you have to break those words in a smaller level to which the child can be able to understand. You cannot use big grammar. You can, because they would not understand. So for instance, if you ask the child you want the child to clean up his or her room, a typical child, you can just say, oh, Jesse, go to your room and tidy up your bed. So the word tidy, you can't use tidy for a special needs child, because the child might not even understand what does tidy means. But when you tell a special needs child, okay, Jesse, go to your room and clean up. So you can say clean up is a general word that is used, but tidy up could be used for a typical child. So they have the inability to understand spoken words.